172 variant were detected in Gauteng and KwaZulu-Natal, each province reporting 2 cases, and all 4 patients have a case history involving recent arrivals from India. The department says all cases have been isolated and contact tracing is being carried out to limit the spread of the variant. The department has also confirmed that 11 cases of the B117 variant, first detected in the United Kingdom, have been found in South Africa. Meanwhile, 2,191 new cases of COVID-19 have been reported in the country. 37 more fatalities were also reported in the latest 24-hour cycle, taking the death toll to over 54,000. Active cases have risen to just over 26,000. And India's Defence Ministry says they plan to recruit hundreds of former army medics to support its overwhelmed healthcare system. Doctors in India have reported a rash of rare infection, also called the black fungus, in COVID-19 patients, which is making them blind. A rare but dangerous fungal infection was discovered yesterday in a 25-year-old woman who recovered from COVID-19 3 weeks ago. It's believed the disease can be life-threatening in diabetics or severely immune-compromised individuals, such as cancer patients or people with HIV/AIDS. To get more information on this, we are now joined via Zoom by Dr. Anant Bhan, Global Health and Bioethics Researcher at Bhopal, India. A very good afternoon to you, Dr. Bhan. Thank you so much for making time for us. First of all, let's start off here. How would you describe the situation that medics are currently facing in India as the surge of COVID-19 cases continue to increase?
Sure. Thank you for having me. Yes, the situation still is very stressful for the frontline health professionals, especially those who are manning our tertiary care centers and trying to manage an increasing number of cases coming through, and also battling with the acute scarcity of supplies in some cases. Unfortunately, beds are largely full in most facilities, and this means that patients are losing precious time as they are being ferried around searching for a bed to be available or an ICU or a ventilator to be available. For health workers also, because many of them themselves are infected, they're working with low capacity and low availability because many of their colleagues have to isolate. And that means that the staff which is working in these facilities is also under a lot of stress, and there are concerns around burnout. So these are difficult times indeed, especially for health.
And the response from the government and also the announcement from the Minister of Defence that they will be recruiting former army medics, how do you see that support coming in and what it could do to help assist with this burnout that you speak of?
Yeah, well, we certainly need more hands on deck. And so if we are able to recruit more people, especially experienced professionals like former army medics who are now retired or who finished their service, then it can contribute in some way to try to alleviate the stress on the health system. But this is probably going to be a small number of professionals who are available. Given the size of our country, we will need to recruit many more professionals. And in fact, we should have already done that by now. Learning from last year's example and knowing also that future waves were a possibility. So of course you can build infrastructure, you can buy more ICUs and ventilators, you can set up new hospital beds. But what can be a scarce commodity is well-trained health professionals. You can't manufacture them overnight, and hence you need to plan to have enough of them available, especially in situations like now, when you have a acute rise of infection.
Yeah. Dr. Bhan, you also speak about some of your colleagues who have been infected with the virus as well. I would have thought that the Indian government would have gone ahead to push at least for the frontline workers to be amongst the first to be vaccinated.
Yes, they are among the first to be vaccinated. In fact, they were the first category of individuals who were allowed to be vaccinated when the vaccination drive started in India. Many of them have taken the vaccines. Some of them might not have for various reasons. But we do know that the vaccines being used are largely very efficacious. They are also safe vaccines. But there have been instances of breakthrough infections happening, which is to say people who have even taken 4 doses still getting infected. But even if they do get infected, the likelihood of serious disease and death is very, very low. So, again, the evidence clearly indicates that people should take the vaccine, and most health professionals so far have done that.
Okay. There's also then the discovery of this fungus that causes patients to go blind, especially COVID-19 cases. What can you tell us about the information around that?
Sure. So this condition is called mycosis, and it's not a new condition per se. It's a rare condition which has been described previously as well, but you wouldn't find many cases, and it would be, most health professionals, especially ophthalmologists or ENT specialists, ear, nose, throat specialists, would see maybe a couple of cases a year. This time during COVID-19, because a lot of individuals are getting steroid therapy, which has been shown to be one of the evidence-based therapies for COVID-19 treatment, especially in the hospital setting. Also because a lot of individuals already have sometimes undiagnosed, but also sometimes uncontrolled diabetes. And we know when people are put on steroids that their sugar levels can go up. Also comorbidity of the kind that you already described. So what is happening is people are probably, because of the steroid usage, having their sugars shoot up, sometimes their immunity levels going down, and they are now more susceptible to this fungal infection. And when it is identified, often after they have been discharged, if it is not caught early enough, then it does lead to serious complications and has a fairly high mortality rate. Hence, I think now there are advisories about being very cautious about steroid usage, and it should only be done under medical supervision rather than being taken at home, and also to watch out for any symptoms which could be indicative of this infection.
What does early detection mean?
Well, I think it would be good to try to track sugar levels, also advise individuals and tell them that if you've taken steroids, if there is a possibility your immune condition is lowered, that you might be susceptible to this fungal infection. Look out for these kind of symptoms, swelling on one side of the face, maybe signs of sinusitis or stuffed nose, any facial discomfort, etc., and any black sort of small drops or spots on your face, especially around the nasal region. And if you see any of this, to very quickly report to a health facility, because some antifungal treatments can be initiated, but the more advanced it is, the more difficult it is to respond.
Mm-hmm. Would you then?
And it could mean you might have to lose your eyesight. They might have to remove your eyes, etc.
Sure. Would you then say that this fungus is not linked to the B16172 variant?
Well, I don't think there is any evidence so far that it is linked to the variant. It's more likely a function of the fact that the treatment which is advised right now for COVID-19, for any variant or any kind of the COVID-19 virus variant, involves steroid usage, and steroid usage coupled with a large number of people having diabetes already could be a major factor which is actually causing this spread of mucormycosis now coming.
Okay, and just finally then, from some of the research that's currently being conducted around this particular variant, that is the B16172, what information can you share with us that some of the researchers, especially in India, have been able to come up with?
Sure. So I think a lot of these variants are typically picked up in genomic surveillance, and we know that there is some evidence which indicates that it might be more infectious in nature, so it might actually be spreading much more faster than earlier, virus variants that we had in circulation. We also know that there have been some reports of potentially RT-PCR tests not being able to pick up this variant, and RT-PCR tests remain the gold standard. So that is a bit of a worry. Fortunately, on the vaccination side, so far it seems to be the case that the existing vaccines which we are using in India are efficacious against this variant, and it's not a cause for worry in terms of will these vaccines also be able to cover these variants, etc. But again, the virus continues to evolve, and we need to keep tracking what is happening in our country and other countries to see how what is the situation at that particular point of time.
Thank you so much for your time. Really appreciate that. That is Dr. Anant Bhan, who is from the Global Health Bioethics Researcher in Bhopal in India. Thank you so much for your time. Really appreciate it.